Welcome to Health Matters. My name is Larry Williams and I'm your host. And today I have the kind of unique privilege, it's also kind of a little weird at the same time, to talk about the Malone Community Center and our health outreach programs. Today my special guests are folks that I work with on a daily basis. That is Miss Regina Sullivan, who is our health outreach worker, or community health outreach worker, and also Pastor Janet Goodman-Banks, who is our breast cancer outreach nurse. Thank you so much for coming and being part of this program. We have, for a number of programs, talked about health issues in the minority community. And what we've done recently is to interview all of the executive directors and their staff people who work on health issues. Now, I'm kind of in that strange position of wanting to interview myself, but I really can't do that. So what I'm going to do for a little bit is just talk about some of the programs we have at the Malone Community Center, and then we're going to talk more specifically, and I'll be interviewing our guests about our health outreach programs. Really, the Malone Community Center has been around for a number of years, for well over 60 years, and we have a very storied history. Recently, what we've been doing is concentrating or having a tremendous focus on youth, elders, and also health outreach. We're very proud to have an out-of-school program that is well received and well known throughout the community. We just recently opened up an early childhood education center for kids aged 3 to 5. We have a teenage club for both young men and young women called the Talented 10th, and also the Strong Courageous Girls Club. In addition, we have a senior program, which is a collaborative effort between aging partners in the Malone Community Center. So we have seniors that are at our center on a Wednesday and also on a Friday. Then we're a food distribution point in the city of Lincoln and in our community. And that's a collaboration between the Food Bank of Lincoln and also with the Center for People in Need. Finally, we have a new program, or domestic violence program, where we are working with families who are the victims of domestic violence. So if I had to kind of look at all of the programs that we have at the Malone Center, I would say that we have a varied and a very diverse group of programs that serve critical needs within our community. Now, that's generally some of the programs that we have, but more specifically, this program is devoted to health-related programs and health issues. So at this time, I think I'm going to go right into talking to Regina and Reverend Banks. Regina, why don't you tell us a little bit about yourself? How long have you been an employee at the Malone Center? And specifically, what do you do as a community health outreach worker?
Okay. I was born in South Omaha, Nebraska, and I moved here with my mother when I was 11. I've been here, went to high school here, graduated from Lincoln High here, and I've been the health outreach specialist at the Malone Center for a little over 5 years now.
Okay. And kind of tell us generally, what do you do? You know, what's a typical day like for Regina?
My day consists of finding minorities in the community that do not have any insurance, low income or no income, and helping them either navigate the Affordable Care Act or helping them get into a medical or dental home without insurance.
Okay, all right. Thanks for that broad overview. Reverend Banks, maybe you can talk a little bit about who you are, how long you've been the breast cancer outreach nurse, and what some of the duties that you do. What is a typical day for you?
Well, I'm a native of Indiana, near Gary, Hammond, Indiana. I've been here in Lincoln for approximately 20 years. I've pastored a church for 10 years, and I'm in leadership at another church here in Lincoln. And I'm also a breast cancer survivor, as well as a nurse. So a typical day for me is rising early in the a.m., checking emails to see if any clients or partners have emailed me or texted me concerning the program or services. I do research. I post educational materials on my email and Facebook, anywhere I can. And a typical day for me would be also to venture out into the community in the demographics where I believe people of a low income stature would be places like a food bank, a food net, Matt Talbot's, churches, places of that nature, and see if I can speak to people, particularly women, one-on-one concerning getting screened for breast cancer.
Okay, all righty. Let me go back to Regina. Maybe you could talk a little bit, Regina, about some of the main concerns or main health issues that are faced by African Americans in the city of Lincoln. And I think there's probably 3 or 4, but you can tell us.
Yes, right now our main concerns are tackling obesity, hypertension, and prediabetes or diabetes within the community.
Okay. And what do you do? You know, and we've talked about this in our other programs, under that Minority Health Initiative grant that we received from the Lincoln Lancaster, from the Department of Health and Human Services. What do you do specifically to try to reduce obesity, reduce diabetes, reduce or at least combat cardiovascular concerns? What do you do?
At all of the health fairs that are held at the Malone Center, I have screenings. I have a nurse there that will do a blood pressure screening, a diabetes screenings. I even go as far to try to get people blood pressure cuffs so they can take with them, so they can, you know, keep track of their blood pressure. And we have strips and glucometers, and just getting those people those resources and information on how to, you know, take care of your diabetes and hypertension is part of my job.
Okay. Maybe you can talk a little bit about the way we do things at the Malone Center when it comes to organizing and supporting health fairs. You can talk a little bit about what we do and then also about other health fairs that we attend throughout in the community.
What we do is have about 4 or 5 signature health fairs every year, which include Juneteenth, the Back to School Jam, which we just had a month ago, Halloween Health Fair, Holiday Health Fair, and Take Time for Health Fair. At these health fairs, we have screenings, like I mentioned before, and we also have available a lot of resources in the community, such as DHHS, Lancaster County Health Department, Family Health Services, Partnership for Lincoln, just to mention a few, that will come and share their resources on how to stay healthy within Lincoln for adults and their children.
Okay. So in many ways what we do, I shouldn't say in many ways, it seems like what we will do is we piggyback onto an event that we know there will be a lot of people, but we provide for them these health screenings and health information resource tables for healthier living, basic wellness. Is that fair to say?
Yes.
Okay. And just generally, what do you think the numbers have been when it comes to attendance at these different events?
I've learned from my mistakes over the years, so we are getting better at this, and I think this year's Back to School Jam was the most popular out of all. We had about 700 to 800 people in attendance. So, and just being able to reach that many people with healthy resources is powerful.
Yeah, it is powerful. That's a lot of folks. And I failed to mention in my introductory remarks, if we look at all of our programs, it's probably around 14,000 people that we impact or that we touch, or that receive some of our services. That's the best way to say it. You know, now we talked about the health screenings, and you get people get these health screenings, but what do you do with them? You know, after you get them.
It's always nice just to know that base number so you know where you're at, and from that point, if they need a dietitian or a diabetes specialist, I refer them to those resources as well. Okay. You know, just another way to be accountable and stay healthy.
Any type of follow-up? I think folks have to fill out a form or something.
Yes, I have a intake form that everyone has to fill out. It asks numerous questions, including, are you hypertension, pre-diabetes, or have obesity in your family? So. And
if you've not been screened for that, sometimes you can be screened right there, or you can help them set that up.
Yes.
Okay. And generally, how many people have you probably each year, if I recall correctly, at least 100 or 100 plus?
Yes.
Folks that you have.
I exceeded my goal last year and had close to 200 people screened.
For diabetes, cardiovascular, and obesity.
Yes.
Job well done.
Thank you.
Job well done. Reverend Banks, maybe you can talk a little bit about how we go about trying to find women and make sure women are getting properly screened for breast cancer. And you can talk about how you go about doing that through the program with the grant from the Community Health Endowment.
As I stated earlier, I'm out in the community pretty much on a daily basis at the various food nets, food banks, any events that I can piggyback off of with the Malone Center, with Regina. She does such an excellent job in putting together events. And by phone, email, text, however I can reach people through the grocery store, through church. I'm always asking people, have you been screened? Mm-hmm. Do you have access to getting a mammogram or a clinical breast exam? And if they tell me no to either one, I'm more than willing to walk them to through the process of a form that I have that they fill out. It's not very lengthy at all, and I'm part of a breast cancer coalition here in Lincoln, where there's numerous partnerships around the table where I can go to them as well and ask for different avenues as far as getting people in the community screened. Mm-hmm. So the grant is part of that in helping them to get screened. I send them either to People's City Mission, or we have a surgeon on our Lincoln Breast Cancer Coalition, and I can send them there as well.
Mm-hmm. Not only do you ask the question, but you also try to help them find the resources or find the place where they can go to get that exam completed.
I do both. I feel very passionate, as I believe you have witnessed me in pursuing this question with women. Are you capable? Are you able to receive a clinical breast exam or a mammogram? And if not, I can help. Mm-hmm. I can assist.
Okay. We have about 2 minutes left in this first half of the program. Can you talk a little bit about, and this is a question that just came to mind right now, but I know you can talk about it. Let's talk about that. For 2 years straight, we've had the University of Nebraska Medical Center, I don't want to call it a van, but it's almost like a mobile home that's been up here during our Juneteenth celebration that provides exams. And so, I mean, they just don't go anywhere. So. And it takes quite a bit of work to get them here. So maybe you can just talk a little bit about what that has meant to our Juneteenth celebration and how many women have gone through that mobile unit.
That is a clinical RV that comes from the University of Nebraska Med Center School of Nursing in Omaha, and they have been very, very generous in coming down 2 years in a row to our Juneteenth. And I actually learned of them through Regina, but passionately pursued them in coming down, and they've served the community very well with their nurse practitioners coming alongside of the women here, examining them, giving them clinical breast exams, and also advising them on other resources as well as myself. But that has been a huge part of what I do at Juneteenth, and going out into the event and encouraging women to come over and get screened.
Mm-hmm. Okay. Well, I tell you what, we're going to take a break here, and then when we come back, we're going to continue our discussions with Regina and Pastor Banks, and we'll talk a little bit more about some of the outcomes that we are hoping to achieve from our health outreach programs at the Malone Community Center. We'll be back in about a minute.
What if you could add 5 years to your child's life and make your whole family healthier with simple changes? Partnership for Healthy Lincoln wants to help you and your family live longer, healthier lives. It's easier than you think. Take the dog for a walk, play more and text a little less. Swap out a soda for water once a day. Keep fruits and veggies handy for snacking. These simple changes can add 5 years to your child's life and make your whole family healthier. For more information, visit healthylincoln.org.
Welcome back to Health Matters. Again, my name is Larry Williams, and today it's kind of weird, but I'm talking about the Malone Center, which is my full-time job. And we're talking about health issues and our health outreach programs. And I think what we need to do right now, ladies, is kind of talk about some of our success stories. I know one that we just had recently at the back to school event. We had a woman who was interviewed by one of our television stations here in town, and she mentioned because of our health event, the back to school event, where we have health outreach tables, resource tables, and because of what Reverend Banks had done, she was going to have her first clinical breast exam. So I consider that a success story.
Yes.
And maybe, Reverend Banks, you can talk a little bit more about some of the other success stories that have happened as a result of your outreach work in the community.
Because of the sites that I visit, where I go demographically, as I stated, to the different food nets and food banks in particular, I had a lady at one of those sites tell me that she was so grateful that I was there. Cancer was a part of her family history, and she had never had a clinical breast exam before, nor a mammogram. So I had referred her on to the People City Mission Clinic, and she did go. I took her form down there, and I told her I would, and I told her when to call and what date she had to ask for, which is a Thursday. And so she was so excited when she saw me again. She said, I went, and they were so nice to me, and they did that for me, and they filled out my form for Every Woman Matters, so I'm going to get a mammogram as well. So to me, that's a success story, and that makes me even more passionate about doing what I do.
Mm-hmm. And that woman probably would have never known or never gotten the breast exam
No.
without your outreach efforts in the community.
Exactly. If I had not been present, she would not have had the resources to have that done.
Okay. And I think also we should let our audience know that although our focus is on African American women, we are approaching and we are seeking out women in general to get the proper exam.
Exactly. The grant that we're under, it does specify that we target African American women, but we're not limited to that. So in my trying to reach women, African American women, I'm surrounded by women of all races. So they hear that conversation and they ask me, well, can I sign up too? So I brought it back to the coalition and to the leaders, and they're like, go ahead and sign up whoever needs the help. So I will sign up anybody, anywhere, any place, at any time. It could be early morning or late evening. It can be in a grocery store, it could be at church, it could be wherever. I have no shame about asking, do you have access to getting a clinical breast exam or a mammogram?
Okay, okay. Now, refresh my memory, I forget. You've been the breast cancer outreach nurse for how long?
2 years.
2 years. And I'd like our audience to know that she's going through her second case of business cards. She's going through 500. We just ordered some more. I signed for the check to pay for those business cards. That's true, because you do hand those out to your when you are at the food bank, the food net, Matt Talbert, or at these various church events and women's clubs,
Yes.
you hand your business cards out so that they can call you. So I just want our audience to know that that's a very important part of our outreach effort, having your number, contact information to get those things done.
And even to other partners, I'm like, if you know of anyone that would benefit from this service, please have them contact me.
Even the director hasn't gone through a case of business cards yet. Very good, Pastor Banks. Regina, maybe you can talk a little bit more about the various events that you have throughout the years. And yes, we have the health fair attached to a back-to-school event or a Halloween event or a holiday event, but let's talk a little bit more about some of the things we do when it comes to, food and diet and that whole thing there.
Yes, when we first started doing health fairs, we tried to figure out how to draw people in. So we were doing hot dogs and Kool-Aid, and it's just didn't sit right with me being a health fair. So with the partnership with Healthy Lincoln coming in and with us, we took the pop machines out of the Malone Center and the vending machines, and that's when I decided our health fairs need to be the same. So we have no candy health fairs. We are serving vegetables, fresh fruit. Like at this Halloween health fair this year, we're making ghost bananas. It's just a banana with some chocolate chips stuck in it, makes it look like a ghost.
Mm-hmm.
It's a healthy option, way healthier than hot dogs or, you know, potato chips. And with that being said, we're going to continue,
Mm-hmm.
you know, teach our kids to live healthy.
Mm-hmm.
You can't have a health fair and have junk and candy. It's sending a mixed message.
It's in a mixed message. We need
Yes.
to say walk the talk.
Yes.
Walk the talk. Maybe also we can talk just a little bit about is that I think you got a lot of compliments from attendees about just the notion that we're having a health fair.
Mm-hmm.
Maybe you can talk a little about some of the things
Yeah.
that you heard and were shared with you.
People are excited to know that they can actually come to the community center and have all these resources available to them. You can get anywhere from a breast exam to a gynecological visit if you need. We have people there sharing resources about tobacco. With that, you know, with all those people in this building on a day like that, you can't miss, you know. You are bound to find what you need as far as healthy resources.
Okay, all right. Anything else you would like to add, Reverend Banks?
I just try to complement as well some of the services that my colleague, who I admire so much, presents to the community, and she does it in such a great and outstanding fashion. So I'm just happy to be a part of this health and wellness team at the Malone Center. I'm very passionate about it, and I love working with Regina and my boss Larry Williams. I'm just glad to be a part of the team.
Good, good. Regina, what do you think the future holds? You know, we've talked about some new initiatives that are just sort of in the works, but the work isn't done.
No. I think we should concentrate on having men's health fairs, focusing on, you know, our men in our community. You know, they seem to be the stubborn ones when it comes to the doctor's appointments. So we want to focus on them and ensure that they're healthy too. Also like to get more kids screened at these health fairs. We have a lot of adult screenings, but none for kids. So, and with obesity rates being as high as they are, I think we should start screening our kids at health fairs too.
And we did have recent discussions about the need for having men's health fair. We don't.
Yes.
I think I can't speak for every man in the city of Lincoln or anywhere, but we don't talk about health.
No.
We just don't. And if your wife doesn't or your partner doesn't drag you to the doctor, you don't go
Right.
until it's too late. And I'm a testament to getting proper screening, because I too am a cancer survivor. So there's no question in my mind I'm here today because I was properly screened. And and men don't talk about it. They don't talk about it at all. You know, Pastor Banks, the work in breast cancer is not done at all. Maybe we can talk about the need for us to continue this type of outreach effort to make sure that all women get properly screened.
I am a 6-year breast cancer survivor, and like you said, the work continues. It will always continue until they find a cure. And so with that being said, you know, October is designated as breast cancer outreach awareness. But what I do on a daily basis, I don't wait till October to try to reach people in order for them to get screened. African American women die at a higher rate than Caucasian women concerning breast cancer. Now, Caucasian women seem to acquire breast cancer more than African American women, but African American women die at a higher rate. So with that being said, until a cure is found, the work has to continue. There are too many women out there in the African American community and in the community as a whole that do not have access to health care, to getting a clinical breast exam or a mammogram. And it takes boots on the ground like me to have that one-on-one conversation and establish that relationship and trust and saying, hey, I'm here for you. There are resources that are available that you need to take advantage of, because we want to see you here. We want you here. We want you here for your families. We want you here for the community.
And I like what you said, boots on the ground. There's a need to be out in the community to
Yes.
establish that trust relationship and to encourage women, not through an ad. Not, and I'm not saying there's anything wrong with an ad or a pamphlet or
Right.
a bulletin board or a
Exactly.
billboard. It's more of having that one-on-one contact with a familiar face that encourages women to be
Get the
properly
screening.
screened and have an examination. Okay.
Yes, they look at me with amazement when I say I'm a breast cancer survivor, and so they can hear the passion in my voice as well.
Okay, all right, good. Thank you, Reverend Banks. And again, I want to emphasize, the work is not done. And
No.
we need to continue to go out into the community
Yes.
to make these contacts and to encourage women to get
Yes.
properly examined. Okay. Regina, is there anything else that you would like to add before we come to a conclusion today?
No.
No? Okay, all righty. Well, again, this is Larry Williams, and the focus has been on the Malone Community Center today and our health outreach programs. I hope that you learned something about who we are and what we do, and more importantly, our passion for making sure that all of our people have adequate care and that we're doing a job that we can be proud of and that all of our people will be healthier. That's it for today. And again, this is Health Matters. I'm Larry Williams, and we will see you next time when we'll focus again on issues related to health in the minority and people of color community of Lincoln, Nebraska. Take care and have a good day.